afternoon, everyone. It's great to see you all here. I've been asked to sort of set the stage on, first of all, explaining who the Skoll Global Threats Fund is and why we're really interested in EpiCrowd and engaging you all in this event for the next couple of days. We're a small foundation in San Francisco, California that has a mission to end pandemics within our lifetime. And we know that's not an easy job, and this slide here just shows you all the different issues we actually would have to cover in order to think about how do we find outbreaks fast enough, no matter where they happen around the world, so that we can keep epidemics local, or at least have a regional safeguard, and truly eliminate the fear that infectious disease inevitably have to spread around the world, as we've all thought with the increase in globalization and travel and trade. But what we think is this is the magical yellow brick road, if you will. And this is where we have been focusing all of our efforts at the Skoll Global Threats Fund, is to really think about early detection, verification, real-time reporting that includes engaging the public directly in public health. We're really concerned about the challenge of moving diagnostics to all parts of the world, so it doesn't take us 13 weeks to find out that an outbreak in West Africa was due to Ebola, instead of thinking it might have been cholera or Lassa fever or some other disease. We're very interested then in moving in early detection to enabling rapid response and new models of governance that I won't talk about today, but are really an important part of the work that we do at Skoll. So with that, I just want to sort of show you, for those non-infectious disease epidemiologists in the room, or for those who are technology people who don't really work in the disease surveillance field, it's not rocket science. It's very simple. We use a tool called an EpiCrowd, which basically is just the number of cases of a disease or an illness or sometimes even deaths over time. And so in a general epidemic that relies on routine disease reporting, we may end up with an EpiCrowd in this cartoon version that looks as such. If we got better about physicians, healthcare workers, nurses, other allied health professions reporting diseases earlier as astute clinicians, we know we can find outbreaks faster, which hopefully would result in a smaller EpiCrowd. In other words, less people infected by that disease. We have been very successful as a global community through certain sentinel networks. Influenza is probably the best example, where we collaborate across the globe so that we can look for this particular illness, and there's other sentinel networks for vector-borne diseases, food-borne diseases, and so forth. And those networks have helped us find outbreaks faster and reduce the size of an outbreak. What we're here today partially to talk about is the new field of digital disease detection that is allowing us to look at big data sources and other non-traditional sources of surveillance to find outbreaks even faster. And there's going to be lots of talks on that over the course of the day. Participatory epidemiology, which some have thought of as part of the digital disease detection community, but it's really about engaging populations, whether they're the general public, healthcare workers, different sectors, who can add value to helping us find outbreaks faster, and also provide a two-way communication for us to engage them as part of the response. And if we were really good, we would be finding outbreaks faster while there's still in animal outbreaks and not allowing those to jump into humans. But I think we have a long ways to go yet to achieve that goal and not having an epidemic curve of humans at all. For those of you who might not have heard of Skoll Global Threats Fund, maybe you've heard of our sister foundation Participant, and we collaborated on our first project together in creating this movie, Contagion. And the purpose of the movie, if you haven't seen it, this is not really a spoiler alert, but it's to emphasize the One Health component about humans, animals, and environment all being part of the reason we're seeing a lot of emerging diseases or re-emerging diseases. And we were hoping to bring this to the general public through a movie like Contagion to really spar some interest in looking at epidemics and pandemics. So since this we've been started in 2010, this is an example of just some of the new ideas, policies, and technology partners who are out there. We're all looking to try to find outbreaks faster, and it's exciting to see this field growing very, very quickly. I personally got started with the idea of digital disease detection when I was working at Google.org, the foundation of Google, and I joined them in 2006 and worked with a group of engineers there, and we were trying to figure out, is there something specific that Google as a company could add to the field of disease detection that was unique to them? And so the idea was, could we look at all of the searches on Google that were aggregated as a whole and anonymized, and try to figure out if we could find early detection of diseases by what people were searching on the internet. The challenge that we had at the time was we needed a gold standard of which to measure what a signal on the internet looked like compared to a real disease. So we chose influenza because in the United States, it's a very seasonal pattern of flu, and then no flu, and then we have flu again the following year, and then no flu. So that allowed us to look at all of the search terms on Google and match up any term that actually followed the pattern of influenza for the United States. And over a 2-year period of building this tool and running it with the Centers for Disease Control behind the scenes for a year, where we would call them up and say, we are seeing this level of influenza in the United States, and they would say, oh, no, we're just seeing this lower level, and then 2 weeks later, their level would exactly match what we saw on Google Flu Trends. So we were about 2 weeks ahead by just looking at what people were searching on the internet for indicators of flu in the US. So when I moved to Skoll and the movie Contagion came out, we were trying to think, what more could we do that might even be a better signal than looking at what people are searching on the internet? Because the one thing we don't know about those search terms is whether the people who were searching actually were sick themselves. And so the idea was, could we create an opportunity to get that same information directly from people themselves? And that's where participatory surveillance came into play, and we created a tool along with our partners at Health Net and Boston Children's Hospital called Flu Near You. And the idea is that we ask people every week through either a mobile app or a push notification or the web whether they have any symptoms of flu. And this just shows you, this is a current screenshot where we show all of the people who have been reporting through the system and whether they have symptoms that meet the case definition for the Center for Disease Control for influenza-like illness. They show up as red, they show up as yellow if they had any symptoms at all, and then they're the greenish blue whether they were healthy. So the one thing we're doing is we're asking people to tell us they also don't have the flu, so we can start to have a numerator and denominator in the same system. We then allow you, as you can see in the far upper right-hand corner, this is the user data, but you can also look at the CDC data at any time to correlate with the one system that we have as a gold standard in the US, and we built that as part of the tool. So just to show you the data from this year, we've now been doing Flu Near You for 3 years. But since we ask people every Monday whether they had any symptoms the previous week, you can see where this arrow is showing the reporting date for a given week, and the blue line is Flu Near You, and the red line is CDC. So when we ask people what their symptoms are, you can see that we're 1 week ahead because we ask people, or we're 1 week behind because we ask people their symptoms from the week before, but we're still a week ahead of the CDC. But even as you see it play out this year, the self-reported symptoms of influenza in the United States, and this graph is the same for all 3 years, correlates very nicely with what's been reported through the surveillance system for the Center for Disease Control. So we're really excited that the idea of relying on the public to be part of the solution seems to be a really good way to go. So with that, so when Flu Near You was launched, we were approached by the US Center for Disease Control to see whether they could use the same tool that we were using for influenza and add some symptoms so that they could test this out in Puerto Rico and see whether they could distinguish between different diseases like dengue, influenza, and so forth. And this has been a project that's ongoing right now to really see whether we can broaden it out beyond just influenza. And what we're really interested in is obviously these red areas around the world that are hotspots for emerging diseases. This was a map put together by the EcoHealth Alliance that takes into account things like population density, travel, vector-borne diseases, and so forth, highlighting those areas that are highest risk for new and re-emerging diseases. So while we were really excited about this experiment in the United States that showed we could rely on the public to report symptoms, what we're really interested is moving these to the hotspots around the world where we may not have good surveillance systems and where we may be able to detect outbreaks faster by engaging the public. And the way we've been doing this is to gather both human and animal health experts together with technology partners from the countries in which we hope to implement these kinds of systems. So just as an example, about a year ago we had an EpiHack in Chiang Mai that resulted in 2 tools that have now been implemented. This is just showing you the group, a small group, mainly a lot of young developers. And they now have 2 participatory surveillance tools in Thailand, one which is for the entire country, where they can report symptoms just like they do in Flu Near You, but for all diseases, through a tool called Dr. Me. And most recently, we have implemented a project that we hope exemplifies what we want to do with all participatory surveillance in the future, which is the PODD project, which stands for Participatory One Health Disease Detection. And what we've done is taken these same tools now, but put them in the hands of farmers and market workers and other people who have very high contact with animals, so they can not only report on their own symptoms or the symptoms of their family, but more importantly, going back to that first graph, can start to report any animal die-offs or bird die-offs or other things in the environment that could be early indicators of a zoonotic disease before it necessarily gets into humans. And within the first 6 months of this project, the partners in Chiang Mai have identified an outbreak of illness within chickens that literally led to that farmer reporting and killing off all those chickens to prevent that infection from going anywhere else in the community. We've also identified a couple of potential rabid dogs, and this is all being done through volunteers in the community who are using the mobile phone to report these different symptoms. About the same time we were doing that, we were approached by the Ministry of Health in Brazil who said, hey, couldn't we use a tool like you're using for Flu Near You and think about using it in a shorter term for a mass gathering? And so this data was presented at a couple of meetings since then, and you'll hear a lot more about this at the meeting. But we were able to take that tool with the local developers here, the EpiCrowd team, who most of you have met, who have put together this incredible event for the next couple of days. And they, together with the Ministry of Health, created the world's first application of using participatory surveillance at a mass gathering. And I'll be excited for you to see that data as it's presented later. But for those of you not from Brazil, it basically was a mobile app that allowed you to pick an avatar and tell what kind of symptoms you were having every day during the World Cup. Which has led us to where we are today. We have a commitment to implement participatory surveillance at the Olympics, which will be held next year here in Rio. And so what we want to do is take everything that we've learned from the application of the World Cup, as well as what we've learned from engaging people directly through these other tools that we're using in North America, in Puerto Rico, and in Thailand, and really think, how do we really use the opportunity of participatory surveillance to engage people who come to an international event such as the Olympics? And more importantly, can we get them to do as they did at the World Cup, report every day whether they had any symptoms. But more so, we're also interested, is it possible to keep this group connected for at least 2 weeks after they go home? Should something have been identified at the Olympics, such as a case of measles, we could actually reach back out to people after they've gone home to let them know they were exposed and so forth. So that's where we are today now, is here at EpiCrowd, really to pick all of your brains, if you will, to help us think through the lessons we'll share with you that have been learned through all these various projects that I've just showed 1 or 2 slides on, but you'll hear more about them in depth. And to really galvanize all of us here over the next couple of days to think, how do we make the most of the Olympics as an opportunity to really show that engaging people directly could help us find outbreaks faster, and more importantly, provide a two-way communication should important public health messaging be necessary during any mass gathering. So with that, we thank you very much for coming to this event, and we really look forward to engaging with you over the next couple days to make our hopeful endeavor of participatory surveillance at the Olympics be the most successful application of this tool to date. Thank you.